Okay, I'd like to call the meeting of the Services Committee to order. I'll start by just acknowledging this is the first meeting of our new four-year terms. We have some new members of the committee here, so welcome everybody who's new to this committee. And should we go around? Anyways, yeah, happy, we're excited. We got some good work to do over the next 4 years, so on that note, we'll
Sherman, fine.
here.
Susan and Cleary are excused this evening, have a quorum.
Here.
Andrew Joyce.
Here.
Miller. Rosano. Here. Lockhart.
Here.
And Pearlie.
Here.
7 present, Mr. Chairman.
Thank you. First order of business is previous business, approving previous meeting minutes. Motion. Motion, Mr. Joyce. Second. Second, Mr. Pisano. All in favor?
Aye.
Opposed? Passed unanimous. Okay, now on to current business. Well, first we'll split. Commissioner McClave, yes. Right. You just wanted to start with, I know in advance, I asked if you could provide a report on the rental supplement program. So we'll start with that and then we'll move on to the other items.
Okay, good evening. Hello, everyone. So yes, the rental supplement program, we have currently right now 65 active households enrolled, 6 approved who are looking for places to go. And about 14 more applications in process. And in the last year, 2023, we spent $376,000, but December is not processed yet, so probably another $40,000 for December. So that's kind of where we're at. We have households mostly are located in Albany, some in Cohoes, Watervliet, only a handful in the outer towns, though, at this point. Most are located in the city of Albany right now.
So you said, so thank you. So you said 376,000 through 2023?
Through November.
Through November 2023 with another, what was it, 40,000 or so?
Around that, yeah.
Okay, so that puts us at 425,000. What was the total? I know we have till March 31st to spend the money, right? So what's the
Yep,
total
we
amount?
have, it was around 900 and minus administrative costs, $950,000, I think it was.
Okay, so we are, I would say we're not on pace, but do you see that have things picked up as we've got later in the year? Do you anticipate that we will be able to spend the remainder of the $425,000?
In 3 months, I don't see how that's possible at this rate.
Is there anything that we can do to get this money out the door faster? Because any money that we don't spend, of course, we leave on the table and return back to the state.
Well, we're building the program, as you can see. I mean, we're now up compared to, I can't remember last time we talked, but, we were, I think, at 50 last time we talked. So it's a slow growth because what happens, I mean, we have processed at least like 50 applications as well that have either dropped out, they never completed the application. So there's a lot of activity occurring. But to make that perfect match, it doesn't happen every time. People go look for apartments and the landlord doesn't want to be a vendor of Albany County. Or their certificate of occupancy is no good. I mean, it's a whole variety of reasons that people get in the program and then it doesn't ever happen for them. Finding low-income housing is still the major barrier. And we have people coming in the program, and they come in, they're for a few months, they're good, and then they disappear. Something happened. They don't recertify, they don't get in touch with us, they left the apartment. So there's a whole bunch of other problems kind of behind the difficulties here.
And do you think one of the barriers is that it covers only up to 85% of market value, not 100%?
That could be some of it. It certainly is a much higher reimbursement than we've ever had. So, and they only have to pay 30% of whatever income they have, kind of no matter what their income is, so.
And so if someone wants to apply for this, they go into DSS, do they have to know of this program and bring it up to a caseworker?
No,
Or
well,
if
they're not
case-
supposed to. I mean, we see evictions every day, practically. And if the person who comes before them might be appropriate for this program, it is mentioned to them and an application would be given to them. So the caseworkers have another tool that they're offering to people. Again, whether the application gets filled out, whether their apartment doesn't meet code, whatever the problem is, it doesn't always pan out. And again, we're targeting families which have much more complex problems. I mean, we've got a couple families of 8 in here, I noticed. A lot of larger families with 3 kids, 4 kids. So the people we're serving, it's having a good impact on their stability. But their lives are they're not stable. And that is a lot of the problem, I think, with keeping people connected in the program and getting them enrolled. I mean, every provider I know is aware of it. They may not be thinking about it every day, but, if they have a special case, this is something we would mention, like, oh, maybe they'd be appropriate for RSP.
Yes. I want to mention, there's a Times Union article, and it mentioned that some counties, I think it was Rensselaer County, had contracted with a shelter, I think a nonprofit shelter, that was, I guess, getting people, who were in shelters into permanent housing using this program and was having more success getting the money out. Is that something that you've considered doing?
I wouldn't comment on that because I don't know what each individual county program looks like. There's a guess that potentially they gave it to an existing provider. That existing provider used it for their existing residents. That, to me, doesn't have an impact. Those people are already housed, they're already stable. Just giving it to one provider to use in their own program is not the intent. Our intent is to get people out of the homeless shelters, particularly with a focus on families, and to prevent evictions. And so our program is a little bit different. Could we give it to one provider to enroll all of their clients in? Possibly. But to us, that's not the impact we are looking for.
Okay, I understand. I think we should probably look into a little more what that model is.
Schenectady also did something different.
Okay, well, are there any questions from the committee about this? Mr. Epicoro?
Yeah, I wasn't part of this committee last year, but just for clarification, this was the same money that we actually returned, the county returned some money to the state last year, correct?
Correct.
Okay, so if that is the case, we have so much homelessness in Albany County. And where we have so much homelessness in Albany County, I don't think we should be returning money to the state where we can actually use those money to help people in Albany County. And so we have to come up with a plan on how we can spend this money that are meant for people who are being evicted or to solve homeless issues in Albany County. And so what I would like from your agency is a plan on how you intend to spend this money so that we do not have to return it to the state in the future, both this year and any other year after this year. So we'd like.
What would you like in the plan? I think that we've talked about this a number of times, and the biggest barrier, as I've mentioned multiple times, is the lack of affordable housing. And I can't make that happen as Commissioner of DSS. I'm asking for your help in making that happen. Can you help in making that happen? That we can have actual low-income housing that people can find that's safe and appropriate? Without that partnership, I don't know what to tell you. We're enrolling people as they find apartments. We don't want to send the money back. We see evictions every single day coming into DSS, utility turnoffs. We have huge problems coming in our door. If we could use this to solve their problems, we're going to do that. But it's state funding. You don't just give it away. You have to enroll in a program. You've got to inspect the apartment. You've got to have a lease or an agreement. There's many, many steps that you have to take to enroll them. And as I said, I have over 50 people that have been in the program that have fallen off. So it's trying to get that stability of people, because this could go on for years. You can receive this funding for years. So it's some of the problems that these families are dealing with, I think, that they're rolling off. But I'll give you what we're doing, and if you can come up with any other ideas, I'd love to hear them. I would be happy to.
Ms. Lockhart?
Commissioner, you mentioned that you go to shelters to try to get people out of shelters, that's the whole idea.
Yep.
Do you have any idea of how many people that we might see in shelters that say, no, I don't want your help? Because I know that happens in other programs that you have. That as much as we know they need it, they're refusing services. Is that an issue?
It's fewer people that, in the single shelters in particular, it's fewer people that really want your intervention than do,
Yeah.
that don't.
Okay.
Fewer people that do than don't, because they're there for a reason. They are probably actively engaging in substance abuse, probably. They may want to keep their own funding if they're on SSI, for instance, and they don't want to spend it on rent, and they don't have to spend it if they're in a shelter. They can come and go as they please. They get 3 meals a day. I mean, so.
It's very multifaceted.
Yeah, it takes a lot of intervention to move people along. All the shelters know about this program. They're offering it. They're trying to work with part of their job is to find apartments for people. So if someone's appropriate and doesn't have any other resources, they're considering this and using this to
I
help.
guess part of the issue I was bringing up that I think you face is, aside from obviously not enough low-income housing, is some of the population, drug addicted, mentally ill, that just don't even take help, even when it's, I'm not faulting them, I understand why they don't. That's what I'm saying, it's very complicated. Not that. we're not
Yeah, there's a lot of
faulting
social problems that
Yeah.
people have that they don't pay their bills. I mean, we've had people on this program, they have to pay their 30%. If they don't pay their 30%, they can get evicted. So that, so there's multiple reasons why it might not be working for people.
them. Thanks, Commissioner.
Mr. Epicor,
You concentrate mostly with families. Do you ever have individuals?
Yes, we have about, I think, like 35% of the enrollees are individuals.
Are they over age 55, or is it easier to find housing for people who can qualify because of their age?
I don't know, I don't have that breakdown as far as, people in shelters they're aging, actually, the individuals are getting a little bit older, over time. But we're talking probably under 55, maybe 45 to 55 is the aging of, singles in shelter. They're no longer really young people as much.
And so it's obviously easier to find for one person than a family.
I don't know about that. It's hard for everyone, really.
Mr. Epicor.
Thank you, Mr. Chairman. You probably don't have the number. If you have it, do you know how many people applied for this program last year and how many people actually received the funding?
There's 65 people enrolled. I can get you the people that have rolled off that were enrolled. So that would be And then there's pending and denied, people who are denied for various reasons, including not being eligible. So, yeah,
So in total, 65 people applied.
right, no, 65 people are currently enrolled, currently receiving the benefit.
How many people walked into the?
I don't know, I'll have to get you that, I don't know
Yeah, I would
offhand.
like that report. I would like a breakdown actually of it. And this is 2024. And I said this when we did the election for chair. 2024 is going to be different. We don't want people walking into the legislature and anybody talking that and giving excuses. We have so many homeless people in Albany County, and everybody has to step up. We have violent issues, we have gun crime issues in Albany County, we have homeless issues in Albany County. And I believe this is time for everybody to step up and be accountable. And if we are receiving money from the state to deal with homelessness, I don't care what has to happen. We need your department to be taking care to make sure that this money is not being returned to the state. Because any money that comes to the state is valuable and people need it. And it shouldn't be returned to the state for any reason. So I need a breakdown of it. I believe I will work with Sam, the chair, to see what we can come up with, maybe a task force on how we can work with the city of Albany with regards to more affordable housing.
That'd be
But
great.
I do not want any money that comes to the county to be returned to the state any further. And that's what I have.
Thank you. Yeah, I'm going to suggest that we set up a meeting, or a meeting where we can discuss strategies about how to get this program working better and get the money out, sometime within the next couple weeks.
We're in the middle of Code Blue right now, I'm just gonna say, we have a homeless crisis in the county.
Yeah.
And our shelters are brimming. And so, we are in crises right now. I'm just gonna say that to you. So, if it's productive, that would be great.
Okay, I understand, and we'll reach out and find a time on our schedule that works. We want to work with you. We think we can, we can have a productive conversation if we sit down and, come up with some
If you
ideas.
fully
Because I know we all
yes,
wanna
it'd be
get this
great.
money out.
It'd be
I-
great.
I
Yep.
understand that.
We don't,
And-
believe
and-
me, that is not my motive, not to keep, not to spend the money here.
That's
And
the
we
issue.
recognize that the lack of affordable housing is an issue too, and we are looking at addressing that in the legislature. I know we have talked about things like the Affordable Housing Trust Fund, there's some other ideas we can talk about, so that's, something we are looking at, we recognize that's a major issue. But now let's, why don't we move on to the rest of our agenda?
All right. Item 2 is authorizing an agreement with IPH regarding emergency and transitional shelter services at Safe Haven. Commissioner?
There we go. It's a shelter. This is a Code Blue shelter that's been operating for many, many years. This is only operating during Code Blue season. It kind of closes the middle of April. They take the people that won't go anywhere else, that might be a little intoxicated, that, don't really want to be sheltered in even a regular shelter because there's too many rules. So this is $578,000 passed through basically from New York State funding for that.
Thank you. Motion?
Second.
All in favor?
Aye.
Opposed? Passed unanimous.
Item 3 is authorizing an agreement with the Altamont Program Inc. regarding a Code Blue warming center.
Yep, this is a new idea we had this year because of our serious homeless problem and the fact that we had way more people than we can house in our shelters. And people were with huge behavioral problems that didn't function well in the other shelters, who refused to follow rules, who were intoxicated or under the influence of drugs. And were kicked out, basically, of other shelters, were in hotel rooms and trashed the hotel rooms. Just really, we had nothing else to do with them. So this is basically a place to get warm. It provides a seat, a box lunch, shower facility, so that people can go basically just to get out of the the weather, they have security on site. So it's operating again through Code Blue probably till March, I guess.
Ms. Rosado?
Hi, could you tell me what constitutes a code blue?
Below 32 degrees.
32. And where is this warming center located?
This is on Ferry Street.
Okay.
It's in my district. Mr. Miller?
I just had a quick question too. In the letter for this one, it talked about the fact that it hasn't been used for a while and it needs work. So this money going towards the work and the services or just? the work?
This is the second contract. The first contract was for startup funds to establish the center and get it renovated a little bit and buy equipment and that kind of thing. This is for operating. This is the 252, I think it is, for operating costs to run the shelter.
So it's the same one as two then? You lost my time.
Same one as
The one
what?
we just did before?
No, that was IPH.
Yeah, that's what I thought. Right.
Right, well, that's also a Code Blue shelter, but
Right.
that's on Sheridan Avenue, and it's been around for decades. This is a new warming center, and yeah.
So the funds are going for both?
Th-
Your
that-
answer lost me. All right, so-
Okay, I'm sorry, I didn't know, what's your question?
So the funds in this one, because it is starting up again, is this the money that started up? or the
No, this is
both?
brand new this year, this is a new facility.
Right. And it says it needs work, it needs to be operational, the letter.
You voted, I believe,
Before.
last month or a couple
Oh,
months
okay,
ago,
before.
on, I think, some funding to get it
That's
up.
maybe that was- I was on-
Yeah, there was 150 that was requested last month or November or something. That was for startup, this is operating, and I hope it says 252,000?
It does.
Okay, thank you.
I'm new to the trade.
No problem.
So sorry.
I think there's a reference to the former,
No, I got it, that's good.
yeah.
I realized I did it
Okay.
before now. I just wasn't here, so, thank you.
Are there any other questions? Motion to approve? Motion?
Second.
Second, all in favor?
Aye.
Opposed? Passed unanimous.
Item 4 is amending the 2024 Department of Social Services budget for administrative adjustments.
We had actually received approval for this pass-through funding for Bright Side Up, which is a vendor selected by the Office of Children and Family Services to provide child care registration and child care center inspection and referral for child care services. And right after we got approval for that contract, the state provided a new amount that they were going to give us $59,918 more than what we originally came for. So we're just asking for a budget adjustment to add that $59,000.
Motion.
Motion, second, all in favor?
Aye.
Opposed? Passed unanimous.
Thanks, Commissioner.
Thank you.
Item 5 is authorizing an interdepartmental agreement between the Department for Children, Youth, and Families and the Albany County Probation Department.
Good evening, committee members, and Happy New Year. So basically, we actually contract with probation to provide juveniles with the treatment and services that they require. These would include the JRUS, which is the juvenile release under supervision, that they track those youth, the Community Accountability Board, as well as PINS 18. And we also have the Parent Project that is operated by probation, and Raise the Age, as we have had legislation passed. So we provide those services to probation, as well as support a couple of their probation officers' salary and fringe.
Thank you. Are there any questions for the committee?
Motion.
Second.
All in favor?
Aye.
Opposed? Passed unanimous.
Item 6 is authorizing an agreement with Berkshire Farms and Family Center regarding non-secure detention services.
Thank you. Yes, this contract would be from March 1st, 24 to December 31st, 24. And basically, these children are remanded by family court to non-secure detention. So they have taken part in some delinquent behaviors, and these youth, both male and female, are between the ages of 12 and 17. And they're remanded there until their next court date, where the judge will make a determination after probation completes their assessment as well. Berkshire Farms has been providing these services for years, and we did put an RFP out, and they were the only provider. They were the sole proposer.
Thank you. Are there any questions from the committee? Motion?
Just one question, Commissioner. Where is this facility, this particular facility?
In Burnham?
It is in Burnham, okay.
Yes.
Okay, I thought maybe moved, okay. Thank you.
Motion, Mr. Miller. Second. Second, Mr. Joyce, all in favor?
Aye.
Opposed? Passed unanimously.
Item 7 is amending resolution number 351 for 2022 regarding officer detention services.
Yes, we needed to amend, or requesting to amend the resolution because of the lapse of time between the RFP coming out, scored, and then the request from purchasing to approve us proceeding with the contract. So this would only be a contract with them for a 2-month period of time. And then the other RLA would be coming in effect with the new contract.
Thank you. Are there any questions? Motion? Second. Second, all in favor?
Aye.
Opposed? Passed unanimous.
Item 8 is authorizing an agreement with the New York State Department of Health regarding reimbursement for administrative costs pertaining to the early intervention program.
Thank you. Yes. So New York State Department of Health provides us funding to have the early intervention program. The early intervention program is for children ages birth till age 3, and these youth have developmental challenges and have, basically are in need of services. So the county is responsible for providing early intervention services, and this helps to support the funding of said services.
Thank you. Any questions? Second. All in favor?
Aye.
Opposed? Passed unanimous.
Item 9 is authorizing the acceptance of grant funding and an agreement regarding the Child Rights Safe Harbor Initiative.
Thank you. Yes, unfortunately, since the legislation passed in 2008, we've seen a rise in the children that are being trafficked. And so we have this money to help not only raise awareness, but provide the services that those youth may need. There's an opportunity to have things on hand like clothing, bags, anything that they may need in order to get away from the person who's victimizing them.
Thank you. Ms. Lockhart?
Commissioner, can you give us an idea how many children you're dealing with in this program?
I will get that information to you.
Has it increased a great deal? since-
Yes, because I think as we are raising awareness with law enforcement and other individuals, agencies, in addition, any of our voluntary agencies that a child goes AWOL from has to be screened for human trafficking when they return.
Is part of this program connected to the domestic violence issue where we have safe homes? Do we have any safe homes for?
We do not at this point in time, no. We work with also crime victims. So if a youth is going into the emergency room, we've been training their staff as well, the nursing staff, so they can identify the suspicions that the child may be trafficked. So again, they will go out, meaning crime victims will go to the emergency room and assess the child at that moment in time. So they're 24/7.
Yeah. Good, thank you.
Ms. Rosano?
Commissioner, who administers the program? Each individual caseworker is being educated for this, and then you...
Yes, all the staff have, but we do have a coordinator of the Safe Harbor Act. Her name is Nicole Consiglio, and basically, we work very closely with crime victims. So she's technically an employee of crime victims, but we support her through this funding.
Thank you.
Mhm.
Thank you. Are there any other questions? Motion? All in favor? Opposed? Passed unanimous.
Item 10 is amending resolution number 238 for 2022 regarding the Healthy Families Home Visiting Program.
Thank you. Yes, the Office of Children and Family Services, a couple months back, advised us that they were increasing by 4% our budget. The reason for the increase was to enhance and recruit more workers into the program, so it is going for their salaries to be increased. It's, and the Healthy Families Program is an evidence-based practice for children at risk of abuse and neglect. And it's an evidence-based curriculum that the workers actually provide to the families.
Thank you. Are there any questions? Motion, second, all in favor? Opposed? Passed unanimous.
Item 11 is authorizing an agreement with New York State Department of Health regarding reimbursement for administrative costs pertaining to the Children and Youth with Special Health Care Needs Program.
Thank you. Yes, and this program is really critical. These children have really significant issues such as sickle cell, muscular dystrophy, asthma, heart conditions, and this money can help provide if they need equipment in order to function daily. And so it can be for non-medical needs and medical needs. And this program is really just a pot of money that's available to families.
Great, thank you. Do we have any questions? Second. All in favor? Opposed? Passed unanimous.
Item 12 is authorizing agreements regarding the Healthy Families Home Visiting Program.
Yes, this would be for the full contract year for the Healthy Families Program. And basically, we submitted this for, again, they serve children in Albany, Cohoes, Watervliet, and Green Island. And this is the evidence-based practice that really helps to improve the parent-child relationship and identify any needs that the child may have.
Are there any questions? Motion, second. All in favor? Opposed? Passed unanimous.
Thank you.
Thank you, Commissioner.
And item 13 is authorizing an agreement with Trinity Alliance of the Capital Region regarding the law enforcement assisted diversion program. Joseph Bonarigo from the Executive Office of the COC.
We've got our project managers, Jenny Hewling, Robert Ward, and Patrick Ellison, the deputy of DMV. This is a contract authorization with Trinity Alliance for the Capital Region for the purpose of providing project management services to our LEAD program.
Thank you. Anything else? Okay, any questions from the committee? You still have longer. That's okay. Any questions from the committee? Well, I want to ask, is this new that Trinity Alliance is now coordinating this, or is this a renewal?
Yes. Yes, it is new.
So I can jump into this a little bit more. So last year, the county released an RFP for kind of project management for the LEAD initiative. That RFP was awarded back in 2023 to Trinity Alliance. This is just the request to kind of effectuate us getting 2024 budgeted funds to Trinity Alliance to get a contract in place so that we can get them this money for project management that they're providing. And it's lumping in 2 years, actually, 2022 and 2024, which is why the amount is $120. Last year, this contract was for $60,000 because it was only covering 1 calendar year. Because 22 has passed and those funds hadn't been spent yet, we decided to put it into 2024 so that it could all be in one, since we couldn't encumber them another year.
Thank you. Actually, we did a press conference in this room a few months back. I think one of the things we announced was more money for the could you give an update on that money, where it's going to? Just a general update about how the LEAD program is working. You know, it's a very important program. Really happy with that.
Sure. I'm Bob Ward. Good evening, everyone. We have two co-project managers, along with Jenny Hewling. So LEAD started in the city of Albany in 2016 with the Albany Police diverting folks from arrest on relatively minor charges, if those charges might relate to homelessness, substance use, mental illness, or poverty. And since then, we've had well over 200 individuals diverted from arrest. Another 50 or so in the city of Albany brought into the LEAD program through what are called social contact referrals. As of the middle of this past year, LEAD has now begun operations in Cohoes and Waterville LEAD as well, working with the mayors and the police chiefs there. So the funding for LEAD over its almost 8 years in the city of Albany has come from a variety of sources, a couple of major federal grants, support from the county, support from the city, some private foundation grants. And so the legislature has previously approved several other contracts for LEAD that flow from some of those federal grants and prior appropriations. But if the committee would like, we can talk about some of the initiatives that will be underway in the coming year, but I know it's late, depending on how much time and interest there is.
Yeah, am I right though that, well, thank you for providing that overview, but am I right that we recently announced or voted on additional funding for LEAD? Was that for the expansion of LEAD?
Is that the expansion?
Well, the $120,000 that Mr. Alderson referred to in this year's budget, as he indicated, is essentially 2 years, a 2-year appropriation. So last year's appropriation in the county budget was $60,000. This year's was $120,000.
I think there's additional opportunities potentially for the LEAD initiative as a whole to secure additional county funding. I know that there's going to be an RFP going out soon to kind of solicit projects locally using opioid settlement fund dollars. So that is certainly an opportunity. I know that the team is working round the clock with even state elected officials to advocate for funding there. I think the federal award that was announced back in 2022, more initiatives are underway as a result of that, and that has kind of fueled the expansion of this project into the cities of Cohoes and Waterville, including allowing for the overall LEAD initiative to hire another project manager to kind of support that geographic area as well. So I think that there's a lot of opportunities out there, but certainly if the legislature wants to support LEAD in additional ways, I don't think they would say no.
We'll discuss that. I think I may have been referring to the opioid settlement fund, but we'll look into that more. Ms. Lockhart?
Thank you, Chairman. Can you tell us how many clients, people you served last year in 2023?
So we're still working on our annual data, and we'll publish an annual report for 2023. But every quarter in the city of Albany alone, case managers work with about 115 people. And many of those folks are served for many quarters. So we'll have an annual update for you for sure. And then there were 19 in Cohoes and Waterville, I believe. So those are about our numbers every quarter.
The 125, are they individual people or are they repeat?
They're unique individuals that we count, yes.
Thanks.
Mhm.
That's
Absolutely,
true.
yes.
Okay, thank you.
Previous year was around 170, if I recall, for all of 2022.
Right, when we put all the quarters together and we take out the unique individuals, the number will rise, I'm not sure how much. But in the last quarter of the year, it was about 100, 115, 120. And yes, in the year, we'll expect more, yes.
Thank you.
Thank you. Yeah, I just want to say thank you for the work you do. I know it's especially with a lot of the problems we see, growing problems we see in our society, with homelessness, mental health issues, a lot of people out on the street, and the changes in our criminal justice system. So it's really important, the work you're doing out there. So
Thank you.
appreciate it.
I looked it up, Sam.
Yes.
This is September, there was increased lead funding and expanding the court, so total of 1.8 million.
Yeah, I think this was the announcement. There was also mental health outreach work.
Check the article.
Yeah, thank you. So we'll look more, we do want to look more into that and see exactly where that money's going. It's getting late, so.
Motion to approve.
Motion, okay. All in favor?
Aye.
Opposed? Passed unanimous.
Thank you.
For our agenda, we have a motion to adjourn.
Thank you.
Second. All in favor? Meeting is adjourned.
Good job.
Sorry.